much for the people. She will give you a sign. Okay.
All right. Good afternoon, Honorable Commissioner.
Yeah, good afternoon.
On behalf of the Board of Bayelsa Health Insurance Scheme, and especially on behalf of the agency, may I welcome you specially to our podcast studio. Yeah, I'm probably one of the first prominent people that are coming into our studio to talk on a little bit about what you think Bayelsa health in Bayelsa generally should go to, what level should we get to, and all of those things. So I'm here to just talk to you a bit on your opinions and your targets as the Honorable Commissioner that is coming in into Bayelsa State. So you are welcome to our podcast studio.
All right. Okay.
May you just introduce yourself?
Yeah. First of all, thank you for having me here. I'm Professor C. Fabricibe, the Commissioner, Ministry of Health, Bayelsa State.
Thank you for coming once again. Now, Bayelsa State was created in 1996. We've gone through the ups and downs. We can't say we are still babies as a state. And you've been in the health system from creation of Bayelsa State till now. How do you assess the health system in the state?
Some of this is personal opinion, but when it comes to official opinion, I'll also indicate healthcare service delivery system is a continuum. And for me, we have made progress. I could remember when I came into Bayelsa in 2007, you could hardly see even a private hospital. And at that point in time, we had probably the only functional hospital was FMC. In fact, when the state was created in 1996, of course, you could see that there was visually no health facility here. Over time, all that has changed. We now have health facilities all over the place. So there is progress. Secondly, the universal health coverage, which is very, very important, access to health, which is very, very important. When Bayelsa was created, most of it, if not all, was out of pocket. Yes. But as we speak, over time, first it was Bayelsa Medical Services around that 2007, 2003. And now we have the Bayelsa Health Insurance Scheme, which is a more sustainable, transparent, accountable, responsible framework. So it means we have made a lot of inroads in terms of that area. Even in the area of service delivery, yes, we may be struggling, but there are also services, there is expansion of services provided within the state, and also services are becoming more accountable because the drugstore, for instance, before now, supplies of hospital commodities were basically from outside. We still have our challenges in all areas, but if you look at that, and I believe that even the outcomes, the behavior of our people coming late to hospitals has also reduced. So with all these outcomes have reduced. I could remember as a growing child around the shores of River Non, cholera outbreaks were like very, very frequent. But now you see that all that has been tamed to a large extent. So we have made good improvement.
Thank you. Thank you for your answers. Now you have been appointed as a commissioner, and this is one of your first assignments you're carrying out, visiting different facilities and places. The governor must have given you his idea of what should be done in your tenure as a commissioner and must have given you charges and mandates. Will you be pleased to share some of those things with us?
Yeah, this is something that I'm so grateful about, because why I say so is that, and I want to thank the governor. At times, governors appoint people and do not give charges. But this time around, with health specifically, and in fact, not only health, but other ministries, charges were clearly stated. And the first was that the Bayelsa Health Insurance Scheme must be expanded. So it means the target is 100% universal health coverage. That is number one. Number two is that facilities must be upgraded. And I think that, of course, the building blocks of health, any health system, the service is the demand and the supply end. And if you look at it, if the facilities, the infrastructures, because most of these facilities that we have in the state have been built over time. And that is also something that we all need to praise the governor for, because he's one governor that has come not to abandon projects that have been done, but improve on them, renovate them, upgrade them. That is one of the major charges. And of course, for all this to work and work effectively, it means the other 6 building blocks of health system must operate optimally. Talk of the manpower, the workforce, talk of technology and commodities, talk of human resources, talk of access to health, talk of service delivery. So we are ready to drive these 2 critical charges with all this, so that our outcomes in the state, not only assessing healthcare or not just the infrastructure being built, but the outcomes will also reflect what is being invested and improve on what we have. No woman that is under labor should, or going delivery or through delivery, we should not lose any woman. So those are the type of things we are charged with.
Thank you very much. And I am sure, I haven't known you for quite a long time, that you have the capacity to vigorously pursue and achieve the charges given to you. It's also our prayer as staff of Bayelsa Health Insurance Scheme that you give us every attention that we need to achieve our mandate of covering everybody in Bayelsa State. Thank you and welcome, sir.
Yeah, thank you so very much for having me.
Thank you.
Thank you.